A 48-hour strike by the nation's resident doctors began at 7 a.m. this morning when night shift staff clocked off. Among them was Resident Doctors Association Otago spokesperson Nick Erskine. He admits strike action is a blunt tool which has affected many people. However, the association believes lives are at threat under current conditions.
Stories just trickle out ever so often of people saying, actually I'm really worried about the fact I've done X, Y, Z, and it sometimes played off for a bit of a kind of just a chat with friends, but actually sometimes you have people who are really upset about what they've done and how exhausted they've become.
Erskine says the association has been pleading with health boards throughout the country for years in an attempt to get safer working hours for all. More than 500 Southern District Health Board patients are affected by the strike, which Erskine says is a last resort.
So the hours a resident can work would be up to 16 hours per day of being on duty within the hospital, and you can work up to 12 days in a row. So that's covering the weekend and then just rolling straight back into another week. And then the maximum of night shifts you can do in a row is 7 in a row, so you can do an entire week working 10 hours per night.
When choosing a career in medicine, people study for 6 years before starting work as a resident doctor. Then sometimes the pressure, long hours and stress is just too much.
Absolutely. So we have people who entirely drop out of medicine throughout their training. We have people who drop out of their specialist training to change to a different field because they find the work too hard and too stressful. And it's a real shame. You go through 6 years of medical school at least, and then up to 10 years of being a resident doctor, and then only to say, it's too much, I'm out of here.
Some non-unionised resident doctors are working through the strike to ensure patient safety. Elective procedures have been postponed for the 48-hour period, and consultants or senior medical professionals are covering shortfalls in patient care. The major southern DHB hospitals at Dunedin, Waikerie and Invercargill are the most affected in the south. Resident doctors are due to return to work at 8 a.m. Thursday morning. Daryl Baser, The South Today.